Question: how is biosoluble curcumin different from regular curcumin? The simple answer is night and day. Curcumin is one of the most difficult supplements for the body to absorb since it greatly resists dissolving in water. As a result, usually the best a curcumin capsule can deliver is less than 40 nanograms per milliliter of blood. However, biosoluble curcumin is enveloped in whey protein, which both makes it highly soluble in water and also allows it to pass readily through the intestinal wall into the bloodstream. That produces yields per capsule of 1,000 nanograms per milliliter. Also, it tastes good, whereas regular curcumin is very bitter. Again, biosoluble curcumin dissolves in water. Other brands don't. An added big plus is that biosoluble curcumin contains no BIOPERINE. Question: how come CurcuminPro tastes so good when other curcumin products are extremely bitter? CurcuminPro, or bio-soluble curcumin, envelops the actual curcumin in whey protein, so your taste buds never come into contact with the curcumin, which is indeed very bitter on its own. Question: bioavailability versus assimilation. These terms are pretty much used and misused interchangeably. Bioavailability and assimilation both describe the extent to which nutrients from diet are absorbed and utilized by the body. The terms are frequently misused in supplement advertising because the products being touted, although they may be absorbed, often may not be utilized by the body. The first question asked is if the supplement could actually pass through the intestinal wall into the bloodstream. If not, then its nutrients are not being absorbed at all. This is usually the case for curcumin supplements. Few get absorbed. Some of these products still claim to be bioavailable even when they are not even being absorbed. The next questions to ask are these: are the nutrients being utilized? Are the supplements soluble in water? Do they dissolve in water? Solubility of curcumin is critical because the male human body is 60% water, and the female human body is 55% water. Bones are 31% water, skin is 64%, the heart and brain are 73%, and muscles and kidneys are 79% water. If a supplement does not dissolve readily in water, it will be very difficult for the various parts of the body to use it. Biosoluble curcumin is the only form I know of which is highly soluble in water and readily utilized. Studies have shown that biosoluble curcumin even passes through the blood-brain barrier, which would allow for the curcumin to be more helpful with Alzheimer's and dementia. Remember, supplements ingested but unable to be absorbed and utilized during their digestive process are of zero nutritional value. Zero. What is black pepper extract or BIOPERINE, and why do people say you have to have it in curcumin to make curcumin work? This is a view espoused by some medical professionals, and it reminds me of the cigarette ads from the 1950s, like this one. Even medical doctors can be wrong, and those recommending curcumin with BIOPERINE are both misinforming and endangering the public. Yes, BIOPERINE does help curcumin pass through the intestinal wall into the bloodstream, but at a significant cost. BIOPERINE harms the intestinal lining, making it more porous by destroying gastric cells, which can lead to bleeding in the intestinal tract. That's why unwanted side effects of BIOPERINE include stomach ache, acid reflux, constipation, loss of potassium, nausea, and even allergic respiratory reactions. Yes, curcumin molecules do pass more easily through a damaged gastrointestinal tract to enter the bloodstream, but so do a host of other toxins, the infamous leaky gut syndrome. Those toxins which enter the bloodstream must be detoxified by the liver so they can be excreted out of the body. Adding insult to injury, BIOPERINE shuts down the functioning of CYP3A4, an important liver and small intestine enzyme, as well as a vital protein. That is human P glycoprotein. Both of these are critical to the liver's ability to break down and excrete the very toxins which BIOPERINE lets enter the bloodstream. Even worse, BIOPERINE blocks the action of the CYP3A4 enzyme in the small intestine and the liver, the body's natural way of breaking down more than half of the medications commonly taken today. Taking as little as 10 milligrams of BIOPERINE a day prevents the breakdown of drugs such as lovastatin and other statins, antibiotics including adriamycin, opioid and painkillers like oxycodone, sleep medications such as Ambien, hormone regulators including tamoxifen, and many, many others. Would you knowingly take 6 or 10 times more of your prescribed daily dose of such medications? Again, that can be the effect of taking as little as 10 milligrams of BIOPERINE a day with your drugs. This blocks their breakdown and excretion, so the drugs stay and build up in your system. Serious negative side effects can and do result. Ironically, one prominent seller on Amazon of curcumin with BIOPERINE boasts that each of its capsules contain 10 milligrams of BIOPERINE. That is medical insanity. Question: what are the health benefits of biosoluble curcumin? Since I don't have 2 weeks to read to you literally hundreds of peer-reviewed studies on this topic, I suggest instead that you visit my website, www.hkacup.com. That's www.hkacup.com. Click on our acupuncture and TCM courses, scroll down until you get to the courses Why Curcumin is the World's Most Used Herb. Download those courses. They're completely free to read. When you download the courses, you can read summaries and references to research on curcumin, which documents that it is helpful for the following conditions. Any problem arising from inflammation, since curcumin is strongly anti-inflammatory, especially pain. Alzheimer's and dementia, arthritis, asthma, chronic traumatic encephalopathy, diabetes, dysmenorrhea, that's painful menses, and PMS. Fluoride toxicity, which hardens the pineal gland, heart disease and hypertension. Curcumin really helps blood to flow. Hyperlipidemia and obesity, kidney disease, liver disease, osteoporosis, Parkinson's, stroke, and thyroid disorders. There are some precautions to take though. Since curcumin helps blood to flow so effectively, do not take it if you're already on Coumadin, Plavix, or any other prescription blood thinner. 2. Also, most curcumin can bind with iron in the gut, leading to iron deficiency anemia. Thus, avoid curcumin which is not enveloped with whey protein. What is the right amount of CurcuminPro to take, and when should I take it? I recommend that my patients in pain take 2 capsules of CurcuminPro Complete or biosoluble curcumin every 8 hours, since it stays in the body for 8 hours. Take 2 upon waking, 2 8 hours later, and 2 before bed. When pain is severe, or if there's a more complicated medical condition, I tell them to up their dose to 3 capsules every 8 hours. Generally, I personally take 1 capsule 3 times a day. However, after injuring my back recently, lifting a 350-pound iron object into a wheelbarrow, and then trying to push it 100 feet, I developed intense back pain, and so I upped the dose to 4 capsules every 8 hours, and by the next day I was much relieved, very much relieved.